Good afternoon and welcome to our October 8th media availability. Following today's announcement with new recommendations from Dr. Deena Hinshaw, Alberta's Chief Medical Officer of Health. With me today is Adam Laughlin, Interim City Manager from the City of Edmonton, and he'll start with some remarks and then we will take your questions. Over to you, Adam.
Thanks, Mary, and thanks for joining us today. As Mary said, some brief remarks in support of the introduction of the voluntary public health measures in the Edmonton Health Zone following the province's announcement that our health risk status has moved to the enhanced level. The announcement of the additional voluntary restrictions by Alberta's Chief Medical Officer of Health reflects our shared concern for the health and safety of people in this region. The increase in case numbers has persisted over many days and suggests people's attitudes and actions towards public health measures have become more relaxed. What is at stake is the safety of our community and the potential for overwhelming our health system. The City of Edmonton is committed to working with public health authorities, local businesses, and Edmontonians to reduce the risk of transmission. Taking additional caution now to avoid a setback in our relaunch efforts is just the sensible thing to do. To repeat Dr. Hinshaw's direction, effective immediately, Edmontonians should limit their social and family gatherings to no more than 15 people. Wear non-medical masks in all indoor work settings, except when you're alone in your workspace, such as an office or cubicle, where you can be safely distant from others or an appropriate barrier is in place. Folks should limit their number of cohorts to no more than 3. A core household cohort, a school or work cohort, and 1 additional sport, social, or other cohort. As always, Edmontonians should continue to wash their hands, keep physically distant, and wear a mask when possible. Social and family gatherings are a key driver in the increase of COVID numbers in the zone, which is why these groups are being targeted with these voluntary measures. As the city will continue to work with Alberta Health and Alberta Health Services to closely monitor the spread in Edmonton. We'll be looking at Dr. Hinshaw's advice to determine if any additional City of Edmonton recommendations are warranted, and we'll provide an update to the Emergency Advisory Committee next week. We've identified a number of areas within our operations where additional restrictions could support the province measures. We're working closely with Alberta Health Services, public health inspectors for increased compliance to the guidelines. Enforcement of the face covering bylaw will be increased with additional enforcement teams deployed to shopping centers and public spaces where we are seeing high outbreak locations. We are reviewing our facilities and special event bookings and permitting for the rest of 2020, and will consider reductions to indoor gathering numbers, as well as capacity reductions for bookings and outdoor event permits. Our approach when considering additional restrictions will be to rely on the second wave progression model and the principles that support it that we've been presenting to the Emergency Advisory Committee over the last few weeks. We are revisiting our plan for reintegrating the City of Edmonton employees back into the workplace. Unless there is a business need to be in the office, we are advising our city staff who can work from home to do so and to continue to do so. We have a mandatory requirement for employees to wear face coverings when moving throughout the office and service spaces. We are glad to see that other workplaces are being advised to do the same to help slow the potential of transmission. Edmontonians are known for being community-minded. They look out for each other, and we've seen this through the pandemic. Over the past 8 months, they've demonstrated how well they can protect themselves and each other under difficult conditions. Today, we are asking Edmontonians to tap into that commitment again and acknowledge that they play a significant role in stopping the spread. This is not how Edmontonians have planned to celebrate Thanksgiving, with small social gatherings. However, by working together, the province, the city, and you Edmontonians, we have the power to change the direction of the pandemic in our zone and return the risk of infection back to a safer level. It's in all of our hands to do this. Thank you, and I'm happy to take any questions.
Thanks, Adam. First up is on the phone, Brianna Carsten-Smith from Global. Go ahead, Brianna.
Hi, Adam. So I wanted to kind of clarify the timeline and when we could see additional measures put in place by the city. So would that be a bylaw, or what would that look like if the city chose to take even additional measures?
Thanks for the question. It's with this being announced today in terms of the voluntary measures by the Chief Medical Officer, we're going to be taking the next week here or less to look at any administrative measures that we could be taking, and we would be providing an update at our Emergency Advisory Committee meeting next week, next Thursday, which is essentially council. Some of the measures that we could use in some of our facilities, we can reduce the capacity to a level that's identified by the Chief Medical Officer, whether that's 15 inside or even fewer, or reducing the outside cohort limit. Some of the other things that we could be looking at is potentially adjusting how our folks within our different facilities are working, and I referenced that we're asking our employees to wear face masks. And then in some of the other areas, we're starting that today, increasing our patrols in terms of the mandatory mask bylaw, and working closely with Alberta Health and Alberta Health Services. If we see a zone or an area within Edmonton that has a higher outbreak case, that we would deploy some of our resources to monitor the area and flag areas for necessary enforcement with Alberta Health Services.
Do you have a follow-up?
Yeah, can I ask about the City of Edmonton employees who have returned to work, and now you're saying they should potentially work from home again? Do you have any numbers on how many people have returned to City of Edmonton buildings that you're now recommending might go back home?
Well, actually, very few, from my understanding, have actually, if they're able to work from home, the predominance have continued to work from home. We were, like other businesses, sort of in the relaunch efforts, making preparations for more returning to work, but with the rise in cases and following the direction of the Chief Medical Officer, we're encouraging our folks that can work from home to continue to work from home. So in terms of specific numbers, I don't have that. I do know that depending on the type of operation, the numbers are fairly high for areas that can work from home that they are working from home. But obviously we have some operations that are very front-facing, citizen-facing, that flexibility isn't there. So I would say that the majority that can work from home are choosing to work from home, and we support that, and we'll continue to support that for our employees.
Thanks, Brianna.
Thank you.
Next up is Dustin Cook from Post Media. Go ahead, Dustin.
Thank you very much. Hi, Adam. Yesterday during the council meeting, you mentioned that the city was looking at potential options to restrict non-essential travel in the city. I'm wondering if you can expand on that, and what's the threshold for implementing that, and what could that look like by restricting movement in or out of Edmonton?
Thanks, Dustin. So just reflecting on when we first responded to the pandemic, and we actually, and not suggesting that we're there, but when we declared the state of local emergency, it was with the intention to be able to restrict travel. So when I talk about working with Alberta Health and Alberta Health Services, if we see a trend of spread in a particular zone of Edmonton, that may be an area where we would consider certain travel restrictions, and And that would be on the basis of our services, and that could be transit, or sorry, not could be, that's transit. Not suggesting that we're there, but it's something that we're closely watching and continuing to engage with Alberta Health and Alberta Health Services. The other thing, recall when we initially responded to the pandemic, the province actually restricted travel into the province, and you know, that could be a consideration in terms of ensuring that you know, with the cases that are in Edmonton, that there is a potential where we look at a restriction of flow into and out of Edmonton. But early days for that, I think when we raised it yesterday with council, what we were thinking is if there's a hot spot within a particular area of the city or zone of the city, that there is the possibility of assessing travel restrictions in those areas. But we take our advice and guidance from Alberta Health and Alberta Health Services, and at this point we're not quite there yet.
Dustin, do you have a follow-up?
I do have a quick one, thank you. The number of City of Edmonton employees self-isolating has increased quite a bit in the last couple of weeks. Do you know if any of these employees now isolating are public-facing employees, and does this amplify the need to look at restricting capacity or closing rec facilities and other city facilities?
The predominance of the cases with City of Edmonton employees are not public-facing. They're call it back of house, but it is our folks have developed, our folks in employee services and within the operational areas have developed a really robust program to help with exactly that, Dustin, monitoring which individuals have those cases and what their role is in relation to public facing. But certainly, especially when you look at the numbers and the increasing numbers, you know, consideration of city facility restrictions or even closures, I think are a real consideration if Edmontonians don't respond in a positive way to this. So, but sorry, I'm carrying on a little bit too much. The predominance of the cases are back of house, and we continue to monitor and make sure that where we have the potential of public facing, that we're taking the steps to address quickly, and that's enhanced by the regular cleaning that has been increased as part of the early days of the pandemic. That actually hasn't stopped. The enhanced cleaning hasn't stopped from the start of the pandemic for both back of house and external facing services that we offer.
Thank you, Dustin. Next up is Emily Mertz from Global. Go ahead, Emily.
Oh, I don't have a question. Thank you.
Okay, thanks. Natasha, you're next. Natasha Reed from CBC.
Yes, hi. Adam, could you comment or could you talk a little bit about what you were discussing last week, I believe it was, in terms of having more authority back for peace officers and bylaw to implement public health orders? And whether, do you think that Hinshaw's announcements today might speed up that conversation a little bit?
Thanks, Natasha. That report was a motion from council to just bring back some lessons learned that we've experienced as a result of the pandemic. And one of the things, you're correct, we highlighted is the potential for more powers for our peace officers, not to necessarily with the need to do enforcement, but rather to have the ability to support the province in enforcement efforts. I think with the close working relationship that we have with Alberta Health and Alberta Health Services, our folks, our peace officers are out there doing additional monitoring, and what that means is that when they do see something that is whether it be a cohort, a group, a business, if they're not complying with the restrictions, they still take the steps to educate and make sure folks are aware of the restrictions. And in the case where there's a non-compliance and they're not following, they would alert the appropriate authorities on the Alberta health side to enforce if that's needed. And I think, you know, if this continues, that might be something that the province may want to consider, because our folks can help in that regard in terms of enforcement. But again, at this point in time, our folks are trying to help from the perspective of education, awareness, and if need be, alerting to the appropriate authorities from a health perspective.
Natasha, follow-up to that?
Thanks. You had mentioned boosting enforcement of the mask bylaw, the face covering bylaw, in certain areas that may be higher risk, and you had mentioned malls. Could you elaborate a little bit on your concern for some of these areas and how, I mean, up to date, we've been seeing a lot of compliance of the mask bylaw, but it sounds as though if we're going to boost enforcement, then there's an issue there. So are you worried now about, with the rising cases, that these public places like shopping malls actually do need, how much more enforcement do we need?
Thanks, Natasha. I think the increase, and it's maybe not enforcement, but assessment of adherence to the mask bylaw is a step to respond to the rising cases that we're seeing. So it's a call to action by the City of Edmonton to make sure folks are adhering to the mask bylaw, and it supplements the call to action for Edmontonians to follow the restrictions that are in place, and what the Chief Medical Officer, Dr. Hinshaw, described in terms of the reduction in cohorts, the more focus on cohorts. All of this is in a response to try and do everything we can to reduce the numbers and reduce the spreads. You know, specifically as it relates to malls, that's a large gathering, an area where there's opportunity for large gathering, and so just the numbers of individuals within that area are much larger than other locations. So I wouldn't say that there's a specific target on malls, but it's just kind of going where the numbers are. And I will say that when it comes to public settings, and you mentioned it, Natasha, the compliance on the bylaw in terms of masks has been really high. So kudos to Edmontonians for doing that. And what we're seeing is, and the epidemiology kind of proves this, that the cases seem to be more related to private settings, whether that be home or weddings or those sorts of things. So, you know, continue to wear your mask, keep doing what you're doing in terms of the public setting, but that has to carry to some of these private settings. And again, the increased enforcement or patrol is really going to where the numbers are, or where a large number of individuals might be coming together.
Thanks very much. I'd like to thank Wanda Workington and Alicia Ponciano for our interpretive services. Thank you to the media on the phone, and thank you, Adam, for joining us today.
Thank you very much.
We'll see you again next week.